Hi everyone, welcome to part 3 of Queerspora. Part 3 will be focusing on sexually transmitted and blood-borne infections, their common symptoms, treatments, and testing. Let's get started. Now, STBBIs basically stands for sexually transmitted and blood-borne infections. STBBIs can be treated or maintained with antibiotics or antiviral medications, and sometimes there are no medications. They can be asymptomatic or symptomatic, and these include having a fever, abdomen pain, pain while peeing, pungent pee, etc. And they can also spread through bodily fluids, for example, semen, vaginal or anal fluid, blood, or even drug equipment such as needles. Common STBBIs include hepatitis B, C, human papillomavirus (HPV), genital herpes, HIV, gonorrhea, chlamydia, and syphilis. Let's watch this brief video to give you all a brief overview about STDs. That was an amazing video. HIV. I'm sure you've all heard of this term. It basically stands for human immunodeficiency virus. HIV is a very common sexually transmitted infection that you may all have heard of. Now let's watch this brief video to obtain more information about HIV.
What is HIV anyway? HIV is the human immunodeficiency virus. It can be transmitted from person to person. HIV is historically associated with social stigma, but that is slowly changing. HIV is transferred through blood, cum, pre-cum, ass fluids, vaginal fluids, and breast milk. Other sexually transmitted infections make it easier for HIV infection to occur. HIV cannot be transmitted through sweat, saliva, or urine. Acts that can cause HIV transmission include condomless anal sex, vaginal sex, oral sex, and sharing sex toys. It's rare to acquire HIV through oral sex, but it is possible to transfer other sexually transmitted infections, like syphilis and gonorrhea, and these can make it easier to transmit or acquire the HIV virus. The most common way to get HIV is through condomless anal sex, especially when bottoming, because the inner wall of the ass is very thin, so it can be easier for the virus to get into the immune system. HIV enters the cells that make up your immune system, which plays an important role in keeping you healthy. HIV replicates, destroying these cells in the process and weakening the immune system. The virus can replicate very quickly if left untreated, and over time, untreated HIV can lead to serious health consequences, including AIDS. So if you have condomless sex, you should get tested regularly for HIV. For a few weeks after infection, the virus may not show up on tests, but the amount of HIV in the body is at its highest, and so is the likelihood of transmission to sexual partners. Some people experience flu-like symptoms or a rash during this time, but many people don't. If you test positive for HIV, you should access HIV care as soon as possible. The medicines used to treat HIV are called antiretroviral therapy, or ART. If you take your medicines as prescribed, you can reduce the amount of HIV in your system. This keeps you healthy and reduces the likelihood of transmission. There is still no cure for HIV, but with an early diagnosis and effective antiretroviral treatment, most guys living with HIV are able to live long and healthy lives. When it comes to the sexual transmission of HIV, there are tools available to reduce the likelihood of HIV transmission, like condoms, PrEP, undetectable viral load, and knowing your HIV status, that can help you have the sex you want. For more information on HIV prevention and treatment, visit thesexyouvant.ca.
That was a phenomenal video. Now that we have an understanding about HIV, let's move on to a video about what undetectable means. You might have heard or seen the word undetectable when you were talking to someone on a gay dating app or in person, but you may not know what this word means. So this video can kind of clarify and give you all a better understanding. Here we go.
What if gay men living with HIV could lead long, healthy lives and enjoy sex without transmitting HIV to their sexual partners? For a lot of guys, HIV treatment makes this a reality. You may have heard guys talk about undetectable or listed in their hookup profile. But what does it mean? Undetectable is short for undetectable viral load, and viral load refers to the amount of HIV in your bloodstream. A lower viral load means a lower likelihood of HIV transmission. Undetectable viral load means that the amount of HIV in the blood is so low that it doesn't show up in the test used to detect it. Maintaining an undetectable viral load is great for an HIV-positive guy's health. Staying in HIV care and having a consistently undetectable viral load is also a highly effective strategy to reduce the likelihood of HIV transmission during sex. With an undetectable viral load, the chance of transmitting the virus is negligible. In fact, new research suggests that it may not even be possible. In recent large-scale studies of couples where one partner did not have HIV and the other was undetectable, no HIV infections took place, even when they didn't use condoms. This is strong scientific evidence. And because it's so effective, many guys consider undetectable viral load when making decisions about their sexual health. Becoming undetectable requires HIV-positive guys to take their HIV medications as prescribed. For most guys, this takes 3 to 6 months after they start HIV treatment, but for some it can take longer. Still, even with medications, not everybody living with HIV will be able to reach or maintain an undetectable viral load. There are lots of reasons why this can happen. Not taking medication as prescribed is the most common reason. Sometimes we forget, or we get too high, or we're depressed. Get support if you need it. As a pause guy, it is important to have regular viral load testing and confirm with your doctor that you are undetectable before using it as your only HIV prevention strategy. Whether you're pause or neg, remember that undetectable viral load doesn't prevent other STIs, so make sure you get tested regularly. Today, there are lots of strategies guys can depend on to prevent HIV. We can enjoy hot sex regardless of a guy's HIV status or viral load. Like PrEP and condoms, undetectable viral load is a great way for many guys to have the sex they want. For more information on undetectable viral load, visit thesexyouvant.ca.
Okay, let's get our brains working some more now. Let's all work on a scenario together. Here it is. This is X. You are at a bar and you think X is very sexy. You're thinking about having sex with him. While you are talking to him, he tells you that he is HIV positive. What do you want to ask next? I'll give you guys, a few seconds to think about your answer. You may pause the video and come up with an answer. And I'll move on in 3, 2, 1. If you asked, are you undetectable? You are correct. Now, X tells you that he is undetectable. Is there a high risk of getting HIV from X? Again, pause the video if you all need a few seconds to come up with an answer. And we're going to be moving on in 2, 1, 0. No. The answer is no. There is not a high risk of getting HIV from X. Now, X is the bottom, so you can wear a condom to be extra safe tonight. Wearing a condom is part of good sexual health, regardless of HIV status. Okay, get naughty now. Now we're going to quickly discuss the common sexually transmitted diseases and their common symptoms. Now we're going to be starting off with hepatitis B. Hepatitis B's symptoms include abdominal pain, dark urine, fever, loss of appetite, and fatigue. Treatment prevention for hepatitis B includes hepatitis B vaccine and hepatitis B antibody injection. Acute hepatitis B does not always require treatment. However, for chronic hepatitis B, treatments may include antiviral medications. You can consult your doctor about this further. Hepatitis C symptoms include bleeding, bruising easily, dark urine, yellow skin and eyes, loss of appetite, and fatigue. Pretty similar to hepatitis B. Treatment and prevention include antiviral medication, and this is usually in the chronic stages of hepatitis C. Next, we'll be talking about HPV, the human papillomavirus, and genital herpes. HPV symptoms include genital warts, raised bumps or warts around the hands, feet, or mouth, or mouth actually. And treatment prevention includes topical creams and ointments. Genital herpes symptoms include genital pain, itching, genital blisters, ulcers, and scabs, or scabs. It can be both. Treatment and prevention include antiviral medication. Next, we'll be talking about gonorrhea and chlamydia. Gonorrhea symptoms include painful urination, pus or discharge from penis, swelling of one of the testicles, and treatment and prevention include antibiotics. Chlamydia symptoms include painful urination, pus, discharge from the penis, and pain in the testicles. And treatment prevention includes antibiotics. These two are pretty similar. Finally, we'll be talking about HIV symptoms. Now, HIV symptoms include night sweats, fever, weight loss, muscle or joint pain. However, based on the video we just watched, there could be many other symptoms like skin rashes. Now, treatment or prevention include antiretroviral therapy, post-exposure prophylaxis, such as PEP or PEP, and also PrEP can be used for prevention. Now, syphilis is the final STBBI that we will be discussing, and symptoms include canker sores, rash on the trunk, which means the back and abdomen, which then spreads to the rest of the body, or there could be no symptoms. Treatment or prevention includes antibiotics, commonly penicillin. If you all need further details or information on these common STBBIs, you can all access Katie's Safer Sex Guide. This resource delves further into the common infections and diseases and also explains the symptoms and treatments. Visit the link to Katie's website, or you can also access katie.ca or the Max Ottawa website for our resources that we have provided for you. Okay, now it's time to change gears and talk about testing. This means it is time to watch another great informative video. Here we go.
What if HIV testing was just part of your regular sexual health routine? Whether he's pos, neg, or undetectable, and whether you want to top or bottom, knowing your HIV status and his will help you make informed decisions about the sex you want. Many of us know that testing for HIV is an important way to manage our sexual health, but some of us are not getting tested or getting tested enough. So how often should you get tested? If you're having condomless anal sex with guys who have a different status than you or guys with an unknown status, then you'll want to test every 3 months. If condoms are your preferred sexual health strategy each time you have anal sex, or if you just like to give and receive oral sex, testing yearly is a good way to go. If you and your regular partner or partners are thinking of giving up condoms, get tested first for HIV and other sexually transmitted infections. You could also explore using PrEP. If you think you may have been exposed to HIV and have symptoms like a rash, a fever, or flu-like symptoms, get tested as soon as you are able to. It's important to know that not everyone who gets HIV will experience these symptoms. In fact, most new cases of HIV are happening when one person doesn't know that they have recently become HIV positive. This means they have not been tested and are not using HIV treatment to maintain their health. The chance of transmission is at its highest in this early stage. If you test HIV positive, the best thing for your health is to start treatment as soon as you can. Medicines to treat HIV have come a long way and offer little to no side effects. Early treatment also reduces the likelihood of HIV transmission to sexual partners. You can be healthy and have the sex you want when you're living with HIV. While you're testing for HIV, it's good to get tested for STIs too. STIs increase the likelihood of passing on or getting HIV, so all guys, both HIV positive and negative, should consider testing regularly for STIs like syphilis and gonorrhea. A great way to reduce STIs and HIV in our community is to test frequently and treat early. You can get tested for STIs and HIV at your doctor's office, some walk-in clinics, or a sexual health clinic. HIV tests are highly accurate and free. If privacy is a concern, know that all HIV testing is confidential. Most locations require a health card and some require an appointment too, but with an anonymous HIV test, you don't need a health card. Instead, you get an ID number and the test results aren't linked to any of your personal information like your name. Your local HIV/AIDS service organization is a safe place where you can ask questions about testing. They can also help you find testing locations and connect you to services that are convenient and LGBTQ friendly. Knowing your HIV status is one way to look out for yourself and the guys you have sex with, and can help you make more informed choices about the sex that you want. For more information on HIV and STI testing, visit thesexyouvant.ca.
What a phenomenal video. Now, just to summarize some key points, if you are having sex with a regular partner or with multiple partners, or if you found yourself being sexually active, please consider getting tested for HIV or any other STBBIs. This is just part of a general good sexual health practice that we should all be a part of, and it can help prevent and spread these infections and diseases. Okay, now we're going to watch a brief video about HIV treatment. Now, we already explained in a few slides before that some of the treatments for HIV include antiretroviral medications. There's also PEP. Now, this video will go over specifics and give you a better understanding of the treatments available. Let's watch the video now.
Today, we are living long, healthy lives with HIV and having the sex we want. HIV treatment has come a long way. For some guys, treatment is as simple as one pill taken once a day. HIV treatment used to come with a lot of side effects, but the medications have greatly improved. After the first few weeks, most people don't experience side effects. If you are diagnosed with HIV, it's important to connect to care as soon as possible. Early treatment minimizes the effects of HIV on your physical health and will put you on a path towards becoming undetectable, which means your medications are working and you can't pass on the virus to sexual partners. There are high-quality HIV care clinics across Ontario that are skilled at treating HIV. Your local HIV/AIDS service organization can support you with finding a doctor, getting connected to treatment, and addressing other important aspects of your health and wellness. Sometimes getting access to HIV treatment is as easy as going to the doctor, getting a prescription, and going to the pharmacy. But for some of us, concerns about costs, lack of insurance coverage, and stigma can make it more challenging. Fortunately, Ontario has several government programs designed to help with the cost of HIV medications. In Ontario, healthcare is confidential under the Personal Health Information Act, and doctors are required by law to maintain patient confidentiality. Don't be afraid to ask your doctor or support worker questions about their privacy and confidentiality policies. Always remember that decisions about your HIV treatment and care are ultimately up to you. So if you're unhappy with how your medications are making you feel, speak to your doctor or pharmacist. You can also talk with a support worker at your local HIV care clinic or community-based HIV/AIDS service organization. If you're having trouble remembering to take your meds every day, there are apps that can help you. Today, Pause guys are taking HIV treatment, enjoying great health, and having the sex they want. For more information on HIV treatment, visit thesexyouvant.ca.
I hope that video explained the HIV treatment options pretty well. Finally, let's all watch a video about post-exposure prophylaxis. This is going to be the last video we watch before the end of part 3 of Queerspora webinar. Here we go.
What if there was a way to prevent infection even after exposure to HIV? If you think you've been exposed to HIV, there's medicine that can help. It's called PEP, or post-exposure prophylaxis. It's a medicine for guys who are concerned that they've been exposed to the HIV virus, either because the condom broke, or slipped off, or because they had condomless sex with a partner of uncertain status. The first dose of PEP must be taken as soon as possible, within 72 hours of exposure. But every hour matters, so if you think you need PEP, don't wait. PEP consists of a combination of anti-HIV medicines taken for 28 days. PEP is not designed for regular use as an HIV prevention method. PEP used to come with a lot of side effects, but these days, many people no longer experience significant side effects. After your treatment is complete, follow the testing schedule recommended by your doctor. Use condoms during this time. Today, if something unexpected happens, PEP might be an option for you. For more information on PEP and when to use it, visit thesexyouvant.ca.
Okay, it looks like we have come to the end of this third part of the webinar. Thank you so much for staying focused and engaged. Please access part 4 to learn more about prevention strategies, good sexual health, and resources. Thank you.